All right, this is Martha Nellock at K-State Olathe, and we're glad that you have chosen to join us today for today's lecture, Cases and Careers in Veterinary Medicine. Our guest speaker today is Dr. Neala Boyer. She is a clinical associate professor at our Pet Health Center there at K-State Manhattan. We've had the joy of utilizing that center twice now when my dog blew out first one ACL and then his other one. So he's had a TPLO there, and we have very good memories of being treated well there.
Great.
So we welcome Dr. Neala Boyer here today, and I will turn it over to you. You should be able to share the screen with all of your.
Very good.
All right.
I shall do that. Let's see here. I'm excited to be here. Let's see. Pull this open.
It's starting.
Okay.
Here you go.
You can see it. Okay, excellent. So I wanted to talk a little bit today about how we utilize fear-free in our center. So fear-free is it is an online program, and it was created by really a very, very large number, most all of the veterinary board certified behaviorists in the world, which there are not many, were a part of this program to create this service. And it was initially created in mind with small animal focus, so dogs and cats. And it has since expanded now to include shelter medicine, as well as equine, as well as avian, and it's growing, and to include other animals. And so the purpose of fear-free is for veterinarians to think very differently about our patients when we see them in the clinic. And it used to be way, way, way back when I first started in my career, it was commonplace that we knew we'd have dogs and cats that were just really scared to come in. And we really didn't think much about their mental health and mental well-being. We didn't offer treats and food as an avenue to try to encourage them to feel more comfortable. We would certainly hold them and cuddle them and love on them when we could, but when they were afraid, we would just do our best with those patients, but we keep going forward to try to get our jobs done that we needed to get done. And sometimes that might include adding more people to hold on to a big dog that is moving around or thrashing around, and might even include maybe we lay them down and we put a few people on the dog to try to hold them still. And the reality is that that type of practice can be very dangerous for our staff and for ourselves, as well as for the patient. If they're thrashing around and they're very uncomfortable and unhappy in the clinic, then it makes everything worse, and it makes that patient go home understanding that, you know what, they learned from that experience that the clinic is a really scary place to be, and the next time they don't want to come back again, or it makes it hard for their owners to bring them back in. So there are still veterinary practices that don't embrace fear-free, but thankfully many clinics are embracing fear-free, and it's a whole system of how we think about treating our patients so that we think about their mental well-being when they're in the clinic, and hopefully they want to come back and see us again, and it's not such a bad experience. So hopefully you'll get a better feel through this discussion about how we do that. So this is a good example. They kind of look like the same animal, but this is a cat who's really the same color as this golden retriever puppy. And there's a few things that we're doing here with this visit. So the first thing I'll point out is that both of these animals are being placed on a non-slip surface or a non-slip mat, because one of the things about being in the clinic is that a lot of times we use these stainless steel tables, and the stainless steel tables are great because they're easily disinfected. But the problem with the stainless steel tables are that they're cold, they're very unwelcoming, they're slippery. In fact, cats can sometimes see a reflection of themselves in that stainless steel table, and it can lead to a fear-inducing response. So instead, we use a lot of these non-slip mats, or we might use towels on the cats or the dogs to try to make them feel more comfortable. The second thing you'll see here is that there's food on this table, and actually the puppy is scarfing up. You can see a little kibble right there. This cat has squeezed cheese, which we use quite a bit of in the clinic setting, and some canned food, and he was really enjoying this visit. And then there's the gentle restraint. So they're really in our practice, and according to Fear Free, we understand that scruffing cats, really the only time that's ever done is when a mama kitten has her, or a mama cat has her baby kittens, and she's moving those very neonatal kittens that are only a few days old. She's moving her kittens and she'll pick them up by the scruff and move them. That's really the only time that a cat should ever be scruffed. And so many cats, when you hold them by that scruff, they'll get more aggressive, more agitated. They're even a bigger risk of sometimes biting or injuring somebody. So here you'll see that the nurse is using more of a kind of gentle restraint on this animal. And here another nurse is using a gentle restraint, kind of restraining without making this puppy scared. And so here's a little video of this kitten, and they're getting a vaccine into it. So she's kind of scratching the cat on one side, trying to distract this kitten that he's getting a vaccine. And you see that he very easily got a vaccine without any overt stress. And here's the puppy just scavenging on the table, eating all the little food bits and pieces he can find, really not even recognizing that he's getting a vaccine. And that's really our goal. That's what we hope to accomplish. And we've learned more in the last few years. There was a nice paper or publication that showed that it really makes a difference in how puppies and kittens are handled for their very first veterinary visits. They come to see us maybe 3 to 5 times over the series of a few months to finish all of their immunizations and get their nutrition on par, get them on deworming medications, flea tick medications. So they're coming in a lot. And if we have these stressful, scary visits where the puppies and kittens are afraid, then that will set them up for a potentially a lifetime of fear-induced behavior. So we really take these puppy and kitten visits very seriously. Good. So here's another one, and this is a very good description of what we commonly face in the veterinary clinic instead of those happy visits. So in this picture, we have a dog who has sequestered himself under a series of chairs. His pupils, you probably can't see them very well, but they're really wide, and he's very apprehensive. He's got his tail laid flat. He's got his ears flattened and extremely watchful. And this dog doesn't want to come out from under the chairs. Here's a video of a cat, and you'll see this little rattlesnake tail. This cat has his ears kind of flattening. We sometimes call that little airplane ears when their ears flatten down to their side, and he's flicking his tail. And this, in fact, describes a dog and a cat that are really very afraid in the clinic setting. So we need to think about what we can do to make these animals less afraid. So this is the first thing we think about when we learn about fear-free and when I teach veterinary students about fear-free. So we think about fear, anxiety, and stress. And so how do we think about, what do those words mean? So fear is something where I describe it to the students where you're in the moment. So you're hiking in the Rocky Mountains and a grizzly bear is right around the corner, and you walk around the corner of your hiking path and there's a grizzly bear and her cub. For me, I don't know about you guys, but for me, that's going to be fear-inducing. I'm going to be quite afraid. I'm going to have an increase in heart rate. I'm going to have that fight or flight kind of response, and I'm going to have to fight, probably not to run, because I know that's the wrong thing to do, but I'm going to have some very real fear. Anxiety refers to thinking about, oh man, we're going to the Rocky Mountains, and I know that there might be grizzly bears there, and I'm really worried about grizzly bears being there. So you're not actually in the face of the grizzly bear, but you're thinking about it. And stress, of course, we all recognize what stress feels like. And there can be some physiologic, some changes in our body, like fast heart rate, increase in our blood pressure, and our animals can do the same things. And we abbreviate that in fear-free as FAS, for fear, anxiety, and stress. So you'll see me use the word FAS as we go through this discussion. And in fear-free, we learn green, yellow, and red. So green means mild fear, anxiety, and stress, or FAS. This animal is feeling overall not too scared in the hospital. They're maybe a little bit worried, but they're okay. I can keep working as the veterinarian and carry on with what I'm doing, but be mindful of their body language in case that changes. Moderate means, hold on, wait a minute, I'm a little worried, I'm not okay with what you're doing, and we might need to change course or redirect or change what we're doing. And then severe FAS means stop. We need to reassess how we're handling this animal, what we're doing to this animal, because they are not okay. So much like a stoplight, green, go, yellow, slow down, and red means stop. So here's a good example of a dog who is experiencing an I'm okay. So this is a favorite patient of mine who is owned by one of the nurses here, and he's in his home setting, and the owner's working on some training things with this dog, and he's following a ball or a toy, and he's really got pretty calm body language, and he's taking treats from her, and he's following her directions. He has a very soft, relaxed face. His ears are forward. He has a relaxed mouth and posture. His eyes are kind of an almond type of shape, and his pupils aren't big and dilated. And if he were to be standing, I think we could see that his tail is pretty neutral with his body. He might even be slowly wagging his tail side to side. One of the common things is that sometimes students think, or clients think, that a tail that's wagging on a dog is a happy dog, and that's not always the case. So we think about the tail being kind of right up at midline, kind of right even with their body, and slowly wagging back and forth. And that's a pretty relaxed, happy dog. We can also have, if anybody knows what a boxer dog looks like, they have this sometimes a short or a stump tail, and they can have this kind of slow little waggle back and forth, or sometimes they even turn their whole little rump all the way to their side because they have a butt wiggle and they're so happy to see you. These are all happy behaviors. So this means green or go, and these guys are often very willing to take treats. So here's a cat that is experiencing that I'm okay. So we'll watch the video. So in this cat, the student is petting this cat, and you can see he raises up on his back and he lifts his toes up. And if she kind of keeps petting his tail down, but you can see a little bit of his tail, and his tail goes up into a little, if you can quickly see that, it goes into a little arch or a little question mark. And so that arching back and that question mark tail and lifting his feet way up on the ground, those are all, and he's actually rubbing his face. So cats have scent marking glands in their face, and so he's actually marking on her hands and on objects nearby. And so this is actually a very happy cat, and I love to see this kind of cat in the hospital. In fact, I just saw one of these cats in the hospital just a few minutes ago that was really pretty happy to be here and wasn't very stressed, which is wonderful to see. Here's a dog and a cat with moderate FAS. So we talked about the green, yellow, and red. So these animals are showing us some yellow. So I want to show you the video of this dog. So this dog has a tail that's really tightly held against his body. He's wagging it, but it's not that up tail that we talked about. And he's walking around sniffing everything in the room. He's panting. The room is not hot. This is probably a 65-degree room, so it's not hot, but yet he's panting. This dog also does some other things like licking his lips and yawning, which can be signs of anxiety. He's holding his ears kind of down or flattened. He has a rather tense face. Sometimes when we look at these animals through the middle of their face, they'll be sort of tensed, or we call that a furrowed brow. I think about that like when I tell my fourth-year students in the veterinary class, if I suddenly told you that you have a pop quiz and it's worth a lot of points and you didn't get a lot of time to study for it, I might get some furrowed kind of brows, kind of that wrinkling through the center of their face. Here's another cat that also is pretty worried. So this cat doesn't even want to look at me. He's got kind of, he's partway closing his eyes and he's looking down. He refuses to look at me. And this cat has his tail, you can't see it on the video, but it's tucked all the way around his body. And he was just really like kind of almost frozen there. And that cat actually, as we kept on, got worse. So this cat, this is him a little bit later. And in fact, this owner had thought that this cat just got really relaxed and was sleeping in the veterinary clinic, but that's not the case. This cat has balled himself up into a little ball, and he is paralyzed or catatonic with fear. So this is an animal that sometimes a client or a student may think, hey, you know what? He's holding still, so I'm going to go ahead and continue my physical. Well, the reality is he's holding still because he is paralyzed with fear. So if we keep doing the things that we do, like doing an exam, or even worse, we try to draw blood on a cat like this because we need a test done. This is a cat that might escalate to trying to growl or bite somebody. And he is giving us all of the neon warning signs that he's really afraid. So this is actually a severe FAS, or a cat that we need to take a step back and say, no, we need to stop. We need to not put this animal through the stress that they're experiencing. We need to do something different. Here's a picture, it'll rotate in a second, of this dog that also refused to look at me. I'm trying to get this dog's attention, but he will not look at me. And so he has a very tense or kind of furrowed brow line through the middle here. His pupils are very dilated. The dog will kind of sniff at the floor here in a second, and he yawns. And he's just doing everything he can to ignore me and say, you're not there. I'm not going to pay attention to you. There you see him sniffing the floor. Sometimes we'll see dogs that start panting through a closed mouth, or they're trembling, or they're trying to get away. These are all animals that are experiencing severe fear, anxiety, and stress. So again, in this case, this is an animal that we want to be mindful of this, and we need to keep in mind, what can we do to make this better for this animal? So the dog with severe FAS, if they escalate even farther, they can have aggression. And this can be a dog or a cat that maybe has never shown any aggression in the past, can suddenly change in their behavior. And I say suddenly, but it's really not so sudden, because these are animals that generally have either given warning signs for a long time, or on previous veterinary visits, they've given warning signs and nobody was paying attention to those warning signs, or they kept doing things that the animal didn't like. And so defensive aggression is what we most commonly see. If we're going to see an aggressive dog or cat in the animal hospital, they often are trying to get away from us. And so they're retreating. Sometimes their ears can be back or flattened, their tail can be tucked, or they're very crouched. And dogs that are defensive will usually show all of their teeth. They're doing everything they can to look big and to look scary so that I will back away from them and leave them alone. They also will have usually very dilated pupils. Offensively aggressive dogs are the ones that I think we can probably all recognize. These are dogs that are lunging forward. Their ears are forward. Their tail is up and aware and alert. They're showing usually their front teeth, and their pupils can be any size. And these are dogs that are trying to actively bite or injure, and they are doing everything they can to get away from you and to get you away from them. So in the veterinary hospital, my goal every day is to never let an animal feel like they have to be this way. And I do feel like over the last several years, since we've been practicing fear-free in our hospital, we see far, far fewer of these animals that feel this way, because they've been working with us for a long time and they have been offered alternatives to ever having to get this way. And I'll talk about kind of how we deal with those patients here shortly. So in cats, they also can have their own signs of fight or aggression. Defensively aggressive cats are usually, if we are going to see aggression, they are cats that just quite simply are doing everything they can to get away from me. So they might have big dilated pupils, they're staring me down, their ears are back, their tail and their posture is hunched. Sometimes they're swatting at me with their feet, trying to bat me away. Their tail can be thrashing, they can be talking or telling me off, vocalizing, and their whiskers are often pulled back. Offensively aggressive cats are the scariest ones. These are cats that can have pupils that are slit-like, they're staring me down, their ears are forward, they're very erect in their posture, they're ready to come at me, their tail goes straight out and then it drops at the end, and they're usually growling or grumbling a whole lot. And again, these are the cats that, again, my goal as a veterinarian and as a caregiver is to never have a cat have to feel this way, so that if I see signs that they're becoming more nervous, I'm going to stop what I'm doing and figure out how I can better manage the situation so they never have to feel like this. So why does it matter? Why do we do these things? So FAS, or as we talked about, fear, anxiety, and stress, can mimic pain, nausea, or even a neurological disease when these animals come into the hospital. And so it really, for me, if I have an animal that is that afraid, it's really hard for me to get useful information on a physical exam. 93% of university veterinarians like myself have been victims of dog and cat bites, so that almost all of us have had this happen. So again, this is a really big concern as a veterinarian, as a safety issue. And I would say that our bite rate in our practice, or our injury rate, has gone a lot down since we've been utilizing techniques of trying to keep in mind what the animal's mental health is and how they're feeling as we examine them. 78% of dogs demonstrated fear when they're put up on an examination table in one study. And we have to think about that. For a lot of us and a lot of pet owners, while sometimes the dogs do get up, and some people don't discourage the dog from being up on furniture, for many owners, their dogs are not allowed to get up onto furniture like the coffee table or the couch. And yet we put them directly onto an exam table. And that may be already making that animal feel very uncomfortable or very not at ease, because they know that at home they're not allowed to do that. So in many cases, we will examine the animal, or I should say in all cases, we will examine the animal where they're most comfortable. And that might be on the table, that might be in the arms of my nurse, or sitting on a chair on my nurse's lap, that might be on the floor. It really, I'm going to let that animal tell me where they feel most comfortable. I think another sad statistic from this paper from 2014 was that less than half of dogs in this study willingly came into the veterinary hospital, and even 13.5% of them had to be dragged into the veterinary clinic or carried. And we would never want to see an animal have to experience that in our hospital or any hospital. So in fact, we go to great lengths to try to help animals to feel more comfortable coming to our facility. And by doing so, hopefully we don't have them being so afraid to come back in. And I've already said this last important factlet is that we want to set puppies and kittens up for a lifetime of happy visits. And by doing that correctly as puppies and kittens, sets them up properly for their future. So here's another study that if you want to be a veterinarian, this is an important one, or if you want to be a veterinary nurse or an assistant in a practice. We know that cats are the #1 most popular pet in the United States, yet over a 10-year period, the number of cats that were coming into veterinary clinics actually went down by 14%. And there's really 4 main reasons that they listed in this study as to why cats were coming into the clinic less often. The first one is that some people just don't understand that their cats need medical care. They need not only vaccinations, but they need exams. They need dental care. They need care of their eyes and their skin. Also cost. And that's an unfortunate reality, is that in order to be a veterinarian, and unless you're going to work in a situation where you work in a shelter where perhaps you don't have to make a living by seeing a number of animals, and in a veterinary practice, cost is the number 2 reason. There's 2 more though. The next one, and I think this is a high point of why I talk about this topic, is resistance to carriers. So cats and pet carriers. A lot of owners don't understand how to fully acclimate their cat to a cat carrier. So carriers, when we bring cats in, they should always be kept in a carrier. It's very unsafe for them to be carried into a practice, but there are things we can do to make them more comfortable in their carrier. Things like keeping the carrier out in the home so that it doesn't just come out for the first time when they're going for a car ride. We often encourage owners to use food or snacks to put those into the carrier, to encourage the cat to sleep or rest in the carrier, perhaps by removing the top of the carrier and keeping a favorite blanket in there. And so keeping it as a fixture in their home where the cat can rest and eat and play is really important, so that they have a positive association with the carrier. Travel. And I think sometimes for cats especially, car travel can be frightening. And so we do use a lot of medication to help with anxiety for travel. And even for dogs, some dogs get car sick. And so we also can think about what we can do to help them feel less nauseated coming in to the practice by their vehicle. The other thing that was pointed out in this study is stress in the veterinary clinic. So not only the patient stress, but that also extends to the clients, because if the animal is stressed about coming in, you can guarantee that the owner who's in tune with their pet is going to recognize that their animal is stressed. And if they see that their animal is extraordinarily stressed, some of those owners aren't going to bring them back for maybe 3 years or 4 years, or as infrequently as they can, because it was really hard on the pet and it was hard on them. So again, part of my job is to help to make sure that that animal's visit goes as smoothly as possible, so that the client feels as comfortable or at ease as possible, so that they do bring them back in a timely fashion, so that I can find health problems before they become more serious and potentially more expensive to manage. So one of the things that our receptionists play a role in fear-free is that our receptionists are also trained of the importance of cat carriers and how important it is to expose them to those things. And so this is a hyperlink or a website that is a really nice resource for teaching clients those tips that I already taught you about how to get cats used to their carriers, and those things like making it a place that they can rest or recline or have treats and toys in them. Really, really important is also that we bring the animal hungry into the veterinary hospital. So some owners like to bring a special treat. We always have lots of treats and food in our clinic to offer them. And we also want to think about, maybe they like toys. Maybe we have the owner bring a special toy with them. Again, we bring them hungry. We think about, how do we make that travel as easy as possible on them? And then there's something called an emotional medical record. And so it's a little different than just the medical record where we keep track of their vaccines and their medical history. We also include their emotional well-being when they come into the hospital. So the emotional record might include things like if the animal does better on the floor instead of on the table, or the animal really likes a particular kind of treat, or the dog or cat does better when the owner stays with them in the hospital. We will consider all of those things and we write them on the medical record, so that the next visits, we already recognize that this animal has specific things that it really likes or perhaps doesn't like. So it really can be very helpful to make this an easier, smoother visit. So the receptionist role in my practice is to review all of those things to make sure that we have all of them ready to go for when the client comes in. We also think about how our waiting room is designed. So our waiting room, we are very, very blessed in our pet health service to have just had a brand new, beautiful facility built for us. And I'll show some pictures of what that kind of looks like here shortly. But we designed our space so that, well, one, the receptionists are right there and they're very aware of their surroundings, so that if they see a dog or cat that's stressed, we're going to try to figure out what we can do to make the visit more comfortable for them. We definitely try to limit the wait time, limit the chaos of a waiting space, and reduce the noise. We also were very, very fortunate to be allowed to help design the center. And I was involved in that process, so that my colleague and I were able to design the spaces so that we had a separate feline and canine waiting space, which is wonderful, because a lot of cats don't do well with around dogs. And in fact, a lot of dogs don't always do so well around other dogs or cats either. So we designed these visual barriers between the species. And in fact, there's even a visual barrier between dogs in our practice. We also designed some elevated surfaces so the cats didn't have to sit on the floor, because sometimes, let's say that a dog was getting closer to the cat space, we don't want those cats to be sitting on the floor and feel like they're a victim of a dog getting up too close to them. So we put them up on a higher space so they can feel more safe. We also built the scale into the floor so that the dogs would have to only walk onto a mat instead of stepping up onto a scale, which is often very frightening. And we often try to offer treats near the reception desk and the scale to make that easier. So here's a picture. This was a mock-up by the architect before our center was complete, and our center is now complete and functional. But in this image, you can see there's a German Shepherd dog there on the right, and that dog is sitting on our scale. We have a reception desk where the person in the blue scrub top is standing. And then we have a separate design space for the dogs where there's this barrier or barricade between. So I think the next image shows, oh, I guess it doesn't. So the space between the dogs is that we can have dogs on one side of that area that are more nervous, so they're not having to look at other dogs. This is, again, a mock-up. We don't have cats that just hang out loose in our center. So this is an architect designed image. But in this space, you see that there's a table here where a cat in a carrier could be. Again, we would never have a cat just loose in there. So architects, I guess, thought maybe we would, but that's certainly not the case. And then we have these glass barricades that are frosted where you can't see between these spaces. So it really keeps it a lot more visually centered so that the cats and the dogs don't have to see each other. And then we have this nice corridor here. We designed 2 rooms right here that are cat only examination rooms. So no dogs go into those spaces, period. And we make those spaces like that so that the cats feel more comfortable in their surroundings. And then this far door here, we actually have a calming space where clients can come and visit their animals. It's designed more like a living room kind of setting instead of a sterile kind of examination room. And we have several other exam rooms and then a large workspace in our center. So it really, having the waiting space designed in this way was very, very helpful to minimize the stress as animals come in. The examination rooms in our center, we also design them with the animal's mental and physical well-being in mind. So we like to have elevated surfaces or perches for cats in our examination space. Some cats actually do really well just being examined on a countertop or a cat tree or cat perch instead of putting them on a table. We also like to reduce background noise. So we have computers in all of our rooms, and we will use YouTube just for calming cat or dog music. I like to use audiobooks for dogs because there's been some studies to show that dogs may actually relax better with audiobooks being played. And cats, there's cat specific music that you can find online or on YouTube that has some kind of cat sounds where it seems to be more appealing to cats. And I use a lot of classical music as well. So again, I showed you the picture of the mat. We try to cover our tables so they're not cold, they're not slippery. We keep a thermostat in the cat room so we can actually keep those rooms warmer for them. We examine the animal again where they're most comfortable. We use gentle touch. We avoid scruffing in our cats. We also like to have the owners present if it's possible, because a lot of cats and dogs do better with their owner there. The students are tasked with preparing all of the supplies for an examination ahead of time. We avoid things like bleach. So anybody who knows what bleach smells like, it's very nasty and it actually can damage. So olfactory, or that sense of smell nerves in cats, can be damaged for a period of time where they can reduce their sense of smell just from using bleach. And bleach is a wonderful cleaner. In a veterinary hospital, it can work, but we don't use it because it can be very, very offensive. So we have other cleaners that are less harsh and less offensive to the animal. We also use things like toys and treats and grooming tools, good lighting in our space, and then also things like soft or pastel colors. Our walls are all designed as a light gray or a light purple color, which of course are K-State friendly colors, but also they are relaxing colors that are not fear-inducing for dogs and cats. And we also try not to examine animals who don't know each other around each other. So we try to face them away from unfamiliar animals to reduce the stress. We also use sound therapy, and I just mentioned this, but a couple notes on this. There actually are some studies. There's 9 studies that I'm aware of in dogs that shows that classical music can actually improve their sleeping, their resting. They can have slower breathing and heart rates and be less stressed than with no sound. And when owners actually came into a veterinary hospital or an examination room and they either played classical music or no music in a study, the owners reported feeling more satisfied and more calm after their visits when classical music was used. They felt like they had a better visit. So they felt better about that visit, which is super important for me as a veterinarian. Or if you own a practice, if you have owners coming in and they feel more comfortable in your business and your place of work, that's a win. I mentioned audiobooks in dogs, which I do use a lot, and then the species specific classical or species specific music in cats. There definitely is some science that's been done on this to show that it can be very effective. We also use a considerate approach when we examine our animals. And I want to show this video. I'm so excited about it because this was the first time I'd actually seen this carrier in person. I'd watched videos of it on YouTube and I was super excited to get to see it for the first time. So I want to show you that video. Put the sound off here. So this kennel, it slides, and this is so cool. So we do a lot of times take cat carriers apart because we don't ever dump cats out of their carriers. We actually either see if the cat will come out on their own. We offer them treats like what they're doing there, or we take the lid off the carrier, and some cats actually don't mind being examined right in their carrier. But this is a really cool carrier that it actually slides out like that. So I don't have to take the whole thing apart. So if you are getting a kitten, this is the type of carrier I'm going to guarantee your veterinarian will appreciate having a carrier like this for your new cat. We also, again, try to modify the environment as much as we can. We know that the veterinary hospital can be a scary place to come because there's lots of sights and sounds and smells, and we're touching animals in ways that they don't get touched on at home, and we're pulling on their legs and checking them out, pushing on their belly. So we really want to be mindful that we're going to try to keep them as calm as possible and determine the best approach for those animals. We also consider that when we touch, we like to maintain the touch. So if I'm examining a cat or dog, I try to keep my hands on them and I use a gliding motion down their body. So I don't start and stop. I don't take my hands on and off of them, which can be very stressful for the animal or very startling. We also use the rule of 2 in cats and the rule of 3 in dogs. And what that means is if I have a dog or cat that I'm attempting to perform something, like let's say we're trying to look in their ears because maybe they have an ear problem. And if I'm trying twice in a cat or more than 2 seconds of attempts and the cat is resisting me from doing that, I'm going to stop and I'm going to see maybe we need to sedate this animal. Maybe we need to give them medication so that or do we really need to do this thing today? And I'm going to keep in mind what the animal's telling me rather than force them to go through something they're unhappy with, where they then later on intensify or become more dangerous to work with. When we vaccinate or we give an injection, we ask the student to touch the animal, to kind of rub the spot they're going to give the injection, pat, maybe we even poke them before we vaccinate. And this is all done really, really quickly within just a couple of seconds, but it does reduce the startle response of a dog or cat when they get an injection. And we also move from the areas that are least sensitive to more sensitive. And in most dogs and cats, the things that they dislike, and this is a broad generalization for dogs and cats, the most sensitive areas tend to be the feet, the face, the ears, the eyes, the teeth. And that's not true in all dogs and cats. And that's something that if an animal tells me, you know what, I really, really, really don't like when you squish on my belly or push on the belly, that's what I'm going to write on their emotional medical record. So perhaps I do that last, or maybe they come in on medicine for anxiety so that they feel less scared when I have to do that next time to them. We also use gentle control. And so this is a video where I had a pretty nervous cat and I'm examining it where it's most comfortable, which was on its nice little calm pet bed in the bottom part of its carrier. So we just took its cat carrier apart and we are examining the cat under a towel where it feels more comfortable. And I am just kind of pulling out the part of the cat that I need at any given time. And the rest of the cat is allowed to hide underneath the blanket. And my nurse is really using very gentle restraint on this cat so that we are trying to minimize the stress that they're experiencing in the hospital. And you see me kind of trying to keep my hand on the cat while I move from one task to another, so it's less startling as I then move that leg out to try to examine it. So this is something I think when I share this with veterinary students, I really hope that it resonates with them. And this is important because historically, when we drew blood on cats, the cat was sort of placed on the side of their body and we sort of stretched them out like a little accordion. And then we used a couple people to hold them, but they would be on their side and we'd be holding them down with 2 people to try to get blood samples done. And what was found through this very nice study was that full body restraint, and again, we're having them on their side, we're immobilizing their head and limbs. These cats had 8.2 times more increased attempts to get away than cats that were passively restrained. And passive restraint means we allow the cat to sit their chest upright on the table surface and we make minimal contact with them. And so what the nurse is going to do is let their chest stay on the table, and then they're just going to kind of rotate their pelvis to allow their leg, because we use sometimes the inside of the back leg is where we would draw blood from. And the cats that had passive restraint stayed on the table for 6.1 times longer. So I believe it was 7 seconds, the cats that stayed on the table once you let them go from a full body restraint, versus 42 seconds, cats that were let go, they stayed on the table longer before they finally jumped down. We also, in full body restraint, we see these cats doing more signs of stress. Their pupils get bigger. They start to hold their ears flat or to the side, or we call that the airplane ears, as they flatten out like the wings of an airplane. These cats are breathing faster and licking their lips. And then lastly, the thing I always like to share with the nursing staff or the students is sometimes people will argue that it takes too long to perform restraint when you do it passively or fear-free. Well, interestingly, this study showed that it took the nurses 6.6 seconds longer to achieve full body restraint than to accomplish a passive restraint and a subsequent blood draw. So there's really no reason not to consider changing the way that we do this in our cat patients to help them to feel less afraid when they come in. And so here's a video where they're collecting blood from this animal. And so the nurse is using a towel and just kind of cradling this cat, and they are drawing blood from the inside back leg. And so she's using her body just to kind of comfort this cat. And this cat did fantastic, allowing blood to be collected in this way. Here's an example of a kitten that initially was pretty afraid in the clinic. And so the nurse is going to use some gentle restraint. She's kind of using her thumb and her ring finger behind the kitten's ears. And then she's using these 2 fingers as an alternative to kind of scruffing or holding this kitten in a way that maybe it might object to. And we have several treats and squeeze cheese and some canned food on the table. And this kitten needs to receive a vaccination. So you can see them quickly kind of touching, pinching, poking before they actually poke with the needle on this kitten, just to get the kitten used to the feel of what they're going to do. And when at first the needle goes in, the kitten pauses for a second, and then immediately the student brings in, I shouldn't say immediately, there you go. The student brings in squeeze cheese as an alternative. They thought, oh, you know what, maybe this kitten's gonna react to getting an injection, so maybe I'll up the ante and give it some squeeze cheese instead. So this is a very rewarding way to vaccinate an animal, because that animal, it isn't fighting, it isn't trying to get away, it is eating. So this is very gratifying for the animal and for us to see them so relaxed. And this is our goal. Here's an example, and I want to make sure that I convey, when we use a muzzle in the veterinary practice, the muzzle is never used as a punishment. The muzzle is used the muzzle is used as a tool so that we can place that. And oftentimes we give food through the muzzle. There are some dogs that will not allow you to give them a good hug to restrain them so that the person examining them can be safe. And so they just won't allow a hug, but they will allow a muzzle to be put on where they can eat through the muzzle. And so this video shows you how that works. Okay, and then moving to this video, we see her advancing where the dog is now putting the muzzle on and she's squirting some squeeze cheese. You could easily use canned food, and that dog is now eating it very readily out of that. And then we've secured that muzzle to the dog. So this is something that we use to acclimate the dog. So we're not using that to punish the dog by any means. This is actually a really good dog. And some dogs just really don't like to be hugged on. They just don't deal well with that. And in fact, a lot of dogs get really stressed when somebody runs up to them and gives them a big cuddle. They might get really big dilated eyes and go, what in the world is going on? They really don't appreciate that. And so this is an example of getting this dog used to wearing a muzzle so that nobody has to restrain it. And in fact, you may be able to go do a full physical on this dog, draw blood, all while he's eating squeezed cheese out of this muzzle. But I might not necessarily feel comfortable drawing blood from a dog who's completely unrestrained. And I don't know if maybe he might bite me. So this is a situation where we can use that muzzle to make sure that we're all very, very safe. So here's a few more tools that we use. This is a really kind of an interesting one. This is called a calming cap, and it was designed, and this is a thunder jacket or a calming wrap. And these were designed for thunderstorms. And we sometimes use them in the clinic. And the thought behind these, so this dog can still actually see through this, but it does reduce visual stimulation. And some dogs really, really relax when you put this on them and the visual stimulus is reduced. And then this pressure wrap is used for thunderstorms for some dogs. And we again use it in the clinic because some dogs actually really like to be snuggled and held tightly. And it's been shown that these jackets in some dogs actually really help to calm them when you put this nice snug, and it can hit some pressure points that can release oxytocin, which is a calming hormone, and can really help them to feel better. This was that same dog that I showed you earlier that was running around the room and felt very uneasy. And he's still panting here, but now he's on a non-slip mat. He's gently being restrained with these tools in place. I will point out, this is one thing we do see on this dog is he's slightly lifting his paw. And sometimes I've had owners say, oh, did you hurt your paw? And they think the dog hurt themselves. And dogs will actually lift their paw like this sometimes as we call it an appeasement gesture, or it's a way to show that they're still a little bit afraid. So if you ever see your dog kind of do a paw lift like that, and maybe they're shivering or their pupils are kind of big, they might actually be afraid. And so it's not that they hurt their paw, it can be a submissive, I'm kind of afraid gesture. We also use a quiet room. Adaptil is a spray. You can also use it as a pheromone plug-in, and we can use those in the clinics because Adaptil is a smell that dogs can have that's calming. It's the same kind of smell that their mother, it's a hormone that they produce when they're nursing their puppies, and it can be calming to dogs in the clinic. So we use a lot of different things in our clinic to help dogs and cats feel less afraid. This is a picture of a spray called Feel Away, and Feel Away is a pheromone we use in cats. So again, the cats respond to this, not dogs or vice versa, but there were some studies that use this in the veterinary clinic where they actually use some rooms with and without this spray, and they showed that the cats were less stressed when we use this spray. And so we'll spray it on towels or blankets in the practice, and a lot of times the cat will relax a little bit better. So this is also something that for some clients, if their cat is nervous for coming into the veterinary practice, we'll have them spray a towel, and then you want to wait about 15 minutes because it has a little alcohol carrier in it that the cat, we don't want them to have to smell that. And then we'll put that towel partially over top of their kennel, and some cats feel a lot more relaxed coming into the hospital with that smell. So it can be a very simple thing that we can do to help them feel less afraid. So I will just briefly touch on this. And so if you're a veterinary student someday, or you go to nursing school, you will absolutely learn a lot of different medicines that we use that are called anxiolytics. So they're drugs that are used in animals to help them feel less scared. And so really the properties that we think about when we're using these medications, they should be reliably effective. They ideally would work pretty quickly, be very safe. No client abuse means that they are drugs that would not be ones that a human might be wanting to take on their own or potentially abuse. They're easy to administer. Some of these drugs can be reversible so that we can reverse them once we've utilized and we've gotten what we need done. Maybe we've drawn blood or we've taken an x-ray, and then we can reverse the drug, because sometimes these drugs can be sedating. That's one of the side effects. And sometimes that's okay because it's mild and the animal can go home and sleep the rest of the day and recover from their visit, and that's not really a big deal. But also, we want them to not be so sedate that they can't learn, that they can come into the clinic and have treats, and it can be a lot of fun. And ideally, the medications would be inexpensive and readily available. We also really think about a client-centered approach. So I mentioned how important it is that a client feel comfortable in our practice and feel good about their animal coming in. And sometimes owners, maybe they've gone to a clinic in the past where everybody just laid on top of the big dog to hold him down to draw blood. And we have to explain to them that when we do that, we might accomplish the job, but in the future, that dog is going to be a whole lot more afraid to come into our clinic. So we want to empathize with our clients and really talk to them about the importance of the animal's well-being of coming in. So not just their physical well-being, but their mental well-being as well. So that's what I have for you. Those are two of my favorite little patients. Absolutely tiny, tiny, tiny little Chihuahuas that are some of the nicest Chihuahuas I've ever met before in my whole life. So with that, I'm happy to field any questions if there are any.
Anybody wants to unmute and ask a question, or type it in chat if you'd prefer. I'm sure Dr. Boyer would love to hear some questions. I think great info, how to read small animal body language, and very helpful for anyone who's working with animals, whether it's your own or in an animal assist program.
Yep. Yeah, that's one of the most important things when our first year students come in. I will talk with them about body language, because and then we graduate on to learning about the medications and the clinic setting. So we kind of slowly introduce these concepts, but really, really for anyone learning about what a scared dog looks like. So remembering that wagging tail doesn't mean a happy, relaxed dog. So sometimes we'll see the tail held really, really low and it's wagging really, really fast. And that can actually be a really apprehensive dog. So you want to really look at that dog and look at their body language and determine whether it's safe to approach them, or even better, let them approach you.
Great tips. I always, when we walk our dog in the neighborhood and the kid starts running up, I said, just a minute.
Right. And
So
some dogs are great with that, but some of them are absolutely not okay with that.
And it's just a good, I think, to err on the side of caution, to teach kids and other adults too, anybody approaching your animal, that there's a good way to approach,
right,
and then a not so cautious way to approach.
And I'll also put my plug in. Sometimes we have clients that let their animals off leash, whether they try to do it in the veterinary clinic setting, which is never okay, or if it's not a controlled environment like a dog park where the dogs are off leash and they're walking the neighborhood and you have this loose dog. And sometimes, the people who will say, oh, my dog's friendly, it's okay. But the reality is lots of other dogs on leash are not okay with that. And they're really terrified by a dog that comes running up to them, or they are very aggressive towards other dogs. So that often leads to injuries for the humans or for the animals. So definitely make sure. I'm also absolutely not a fan of the zip type of leads, the ones that, that go out 25 feet, because I've seen dogs pull their owner, have an owner be walking by a car and have the dog zip out in front of traffic, or the dog that suddenly ends up in another dog's face or a cat's face. So they're very dangerous. So you want to make sure that you've got your dog on a leash that's of a certain length so that you know how far they can go in front of you. Very good. Well, it's always a pleasure to get to talk to you and share some tips and some material.
Yeah, well, thank you so much for joining us, Dr. Boyer, and I hope you have a wonderful evening. If anybody does have questions, you're welcome to send them on to me, msnowak@ksu.edu, or on to Dr. Boyer. You can just Google Dr. Boyer at KSU.
Yep, I'd be happy to field those if you have any questions on this topic or any other about what I do in my career.
Absolutely. And since we have a minute or two, how did you get into veterinary medicine? Did you
Yeah,
always know you wanted to be a vet?
I didn't. So I grew up on a cattle ranch and we had horses and cattle and we had pigs and I had dogs and cats, but they were farm dogs and cats. I never had an animal in the house until I was an adult. My mom just didn't want an animal in the house. So I got to play with all my farm dogs and cats and horses and everybody else. And I always loved animals, but I went to school and got my degree in biology at the University of Nebraska-Lincoln. And I really didn't know what I wanted to do with that degree. So I explored the option of medical school. I explored the option of being a teacher, getting a graduate degree to teach biology. And I took a position as an intern or volunteer at an animal shelter in Lincoln. And I really, really enjoyed it. And from then on, I knew that's what I wanted to do. So a shelter is kind of a tough place to start because it's a hard place to work. There's some hardships there. You see some really gratifying things and some really sad things. And I do enjoy volunteering here with our shelter medicine program. I do some outreach with them. But for me, I decided my senior year of college to go to veterinary school. And then I moved to Missouri and I was kind of all in. So I decided that was the school I wanted to go to. And at the time, it was what I had all my prerequisite college credits to go to that school. So I moved there and I obtained my residency, and thankfully I got in that next year so I could start, and I had in-state residency, which took my tuition cost down considerably. And I've always wanted to be a general practice veterinarian because I love getting to know my patients and clients and taking them from the early puppyhood all the way into the senior golden years. It's very, very gratifying to get to know a family and to become part of their family and to take care of their animal when they're well and they're ill, and to be able to help them along. And for me, being able to practice in a fear-free way has been one of the most gratifying parts of my career, to be able to treat the animals like I know they should be treated and think about their well-being, and they reciprocate that through their affection when they come in. I see a lot more of them that are willing to, they know that they're going to get canned food and squeezed cheese, and we bring out all the fun stuff at the doctor. It's kind of like Christmas when they get to come in. So I am board certified. So that was one of the avenues that after I was a general practitioner, I decided I wanted to become board certified in general practice, which is pretty much the highest level you can achieve. So I'm pleased to say that I accomplished that a few years ago. And I love teaching veterinary students. And Kansas State is a fantastic program that we have here for our veterinary students. It's a lot of fun to be a part of their education.
Well, once again, thank you so much for spending a little time with us, and hopefully you'll see some of these young people there at K-State.
I would love that.
All right. Thank you so much.
You are welcome.
Bye-bye.
Bye-bye.